For those of us in interventional cardiology, really obese patients with BMIs greater than 40 are a challenge. We worry about whether the table will hold their weight. We worry about access complications, and of course, whether their risks of mortality and morbidity are greater. Now in JACC, there are two stories about really obese patients undergoing PCI. The first is from Michigan, and it is interesting in that study from Michigan, the number of obese patients that came to the cath lab between 1998 and 2009 more than doubled from 4% to 8%, and it looks like that number is going up. Not good news. In addition, from that study, obese patients had more nephropathy and more mortality, as well as vascular complications. In the second study, there is a study about access site complications versus obesity, and this is a comparison between normal-sized patients and really obese patients with BMIs greater than 40. It turns out in that study that there was an increase in mortality, but vascular complications, interestingly, did not seem to be very different between the two groups. So what's the take-home message here? First of all, the obesity epidemic continues, and we will be facing more and more obese patients. That's not good news. And secondly, they have increased risk. They have greater nephropathy, and the Michigan study says more vascular complications, and mortality in both studies seems to be greater. This is a problem, and we're going to have to face it going forward. For CardioSource, I'm Peter Block.